Hello, everyone, and welcome to another episode of Health Yes. Here at Cameron County Public Health, we talk about all things public health and more. I'm your host, Javier Chavarria.
And Andrea Gomez. And with us today is Moody Clinic. We are so excited to have them at the table. We want to know everything about them, how it is that they help the incredible community of not only Brownsville, but the RGV. And we're so excited. Well, welcome to the show.
Thank you so much for having us. My name is Jessica Cuevas, and I'm the CEO at the clinic.
Welcome, Jessica.
Thanks so much. I'm actually a speech language pathologist by trade, and the previous director of the clinic called me and asked if I would like to. She was ready to retire, and asked me if I would step into that role. So that's kind of how I came to Moody Clinic. I was a speech pathologist first in the pediatric world, and then transitioned into the CEO position at Moody Clinic.
Wow. Well, congratulations. That's that's great. That's great. How long have you been with Moody Clinic?
I have been with Moody Clinic for 9 years at this point.
Wow. Yeah.
Nice.
I know. Mm-hmm. And we also have
Sammy Jo. I am the development manager at Moody Clinic. At Moody Clinic, I write grants, help with fundraisers, and really engage with our donors. I have a writing background, so it's been great to sort of merge my love for storytelling and merge my love for community impact, and I'm just so happy at Moody Clinic. Please cut that last part.
No, that is great. It makes total sense to bring that kind of different spunk to wherever it is that we go, because you just never know what this other side of you can bring to the table. And so it's always great to have all these different types of personalities, especially when it comes to helping the community. Yes. There are so many ways to do so. So let's dive right in. Mm-hmm. Can we start by telling our listeners, what Moody Clinic is and the type of services that you provide?
So Moody Clinic is a nonprofit outpatient rehab clinic.
Okay.
It's a really technical term. Really what we do is we provide speech, occupational, and physical therapy to children from birth to 21 years of age. We're going to serve children who maybe are diagnosed with autism, who are born with Down syndrome, who had an extended stay in the NICU unit upon birth. Maybe they can't say their R correctly, or they stutter. Maybe they were in a car accident and they have a broken bone and they need to have some rehab. So we're working with a really wide variety of children.
Wow. And is Moody Clinic the only nonprofit rehab center in the RGV?
We are very proud to say that, yes, we're the only nonprofit rehab center that we know of in the RGV. And what just makes our program so very unique is the financial assistance programs that we run to help families afford the cost of therapy.
I think more than anything, that's very impactful for communities to know, that there is a place they can go to, especially if there's financial assistance available. I mean, down here, based on our economic status, just RGV-wide, having that access to that type of healthcare, I can't think that so many parents are just relieved, that to know, or if they don't know, they will now, that this place exists, right?
Yeah.
Yeah, that's definitely what sets Moody Clinic apart. No matter how much or how little a family makes, once they walk into our clinic, they'll be seen no matter what.
Nice. And so what drives the mission behind Moody Clinic?
So the mission behind Moody Clinic is definitely to provide the highest quality of rehabilitative care to children with special needs. But at the same time, our goal is definitely to make this affordable for families. Because what is so devastating is, our insurance companies may tell you only get 11 therapy sessions a year. And a child that may be diagnosed with Down syndrome or autism, they're not going to be
11 is not enough,
cured with 11 therapy sessions. And so we're seeing some of these children for years and years. And for a family to then have to pay out of pocket for those therapy services, it's just astronomical. And when we have children that are extremely medically involved, we're not the only thing that they have. They maybe have multiple hospital stays. They have equipment that comes with them, nursing care that they need. And if we can help these families afford the care that their children so desperately need,
one
then
less thing to worry
Exactly.
about. And I mean, also if they have multiple kids, not just,
it's a family
one.
affair. That's what we say at Moody Clinic.
Beyond these therapy sessions, how does your team get involved with these families? Because it seems like you really care. And I mean, if you can see a child from essentially birth all the way to 21, let's say you see them through all these stages and through the developments and I'm assuming there must be so many success stories from the clinic itself. How is it that or how does the involvement in their life work?
I always say that when they walk through those doors, they become part of the Moody Clinic family. They can be as involved or as not involved as they want to be, because some parents, they're tired the moment that they walk through our doors and they need just a little bit of a break, and that's okay too. But if they want to put the work in, they're invited to come back and into every one of their child's therapy sessions. Their therapist will talk to them about, how did your child progress today? We know the ups and downs medically of the children, and then we also know the financial status behind a family. And if they're struggling, okay, how can we assist you in that? We see siblings walk through the door, especially in the afternoon, because a parent has had to pick up all the children from school and everybody comes to therapy. And so maybe while your sibling is in the back, you're doing homework or you're playing outside on our playground.
Right.
And so we get to know the family as a whole. We get to know grandparents, aunts and uncles, people that end up bringing the children to therapy. And so it really becomes a family affair for us.
And just so the community knows, we had an agency tour maybe 3 or 4 Mondays ago, and I was very impressed as to how children-oriented the clinic is. It's so inviting. It's so colorful. And right now that you mentioned the playground, it's such just a nice area that you really do forget that it's not very clinic-y, like sterile looking. It's very inviting. So I feel like that type of environment, it makes total sense that you guys take that approach of it being a family affair, because it does give off that vibe. So that's a great job that you guys are doing.
One of the greatest compliments, I think, to us is when a patient actually comes back to us. And so, just recently we had a young girl graduate in May. She'd graduated already from Moody Clinic. She was no longer a patient, but she was so proud of herself and proud of her time there that she came back and brought her graduation photo to all of the staff members,
that is so
took
cute.
pictures with us. And there's so many stories like that. One of the girls started driving for the first time.
Wow.
And she has cerebral palsy. She came back and brought her car. She got a van, an adaptive van, and wanted to make sure and show it off at the clinic. So we are still part of their lives years later.
That very much speaks volumes to the environment of the clinic, because it essentially makes them feel like that place, they can call it home, to where they can come back to share those experiences with.
That's definitely what we want.
So quick right there, you talked about graduation. Could you speak to how does a kid get graduated, quote unquote, from the clinic?
So it can happen a couple of different ways for children. So if we have a child who came to us and they were not functioning within normal limits, if they were 2 years old and they're functioning at a 1-year-old level, and now we kind of get them to where they need to be, then they graduate from us. We have children who may need therapy their entire life. They're going to have a need. The need sometimes doesn't go away for some of these diagnoses, but we have a time where a child has plateaued. We're no longer seeing progress. We're seeing a child kind of maintain. And so what we try to do is, if we take therapy away, can they maintain their skill level? And if they can't maintain that skill level without therapy, then they come back into us. But that's what you want to see. You want to see them maintain the level that they have. You want to see them hit their milestones. And so various reasons they can graduate from us.
Oh, so it's kind of like they hit the requirements for, reaching that level where they can be sent off.
Yeah.
Basically. Oh, that's nice.
Yeah,
That's
very
cool.
nice.
And something I haven't asked is, since when has Moody Clinic, been established?
So Moody Clinic has been around since 1952.
Oh.
It's one of the longest standing nonprofits in Brownsville. And what I love to tell this backstory on Moody Clinic.
Let's hear it.
little boy by the name of Charles Stallard was born back in 1945, and his mother was desperate. There were no therapy services of any sort in Brownsville at that time. And so she went up to community members and decided my child and other children like him need therapy services. And so I feel like the Moody Clinic was born out of a mother's love for her child, desperation to seek services, and then determination to make his life a better life. And so I love that this one woman founded this clinic and determined that she was going to do this and not let up for her son.
Wow, such a legacy also, because she not only helped her child, she's helped the children of many, many, many women.
Absolutely. And what we love is he's still alive and well today.
Wow.
He's 80 years old. And he lives in assisted living in Utah, but we're still in contact with his family, and it's just really special relationship.
Oh, I bet. That's a really nice story, and it goes back to, you know, the family affair.
Developing the roots of everything.
Yes, absolutely. Absolutely. That is amazing.
Now, we understand that Moody Clinic works with many families who are uninsured or underinsured. What kind of financial assistance or support programs do you offer to the families there?
So we have two different programs that we really kind of work with families on. The cost of therapy is tremendous for some families.
Oh my gosh, yes.
And so our main financial assistance program, we have a fund that we can give away every single year. And so if a family comes to us, their insurance is only paid for, like I said, 11 therapy sessions a year. They're going to continue to see us based on what their therapist recommends. Their insurance will continue to deny their claims, and they end up in another pediatric rehab facility, they would end up getting a bill for that.
Right.
They'll get a bill for us, but we're going to work with them. Can they pay 10% of the bill? Can they pay 20%? Can they not pay any of it?
Just
What do
making
we
it more
need to
accessible.
do? Really making it accessible for them. And the one program that I think the staff and I and the board of directors is the most proud of is the Charles Stallard Legacy Scholarship Program.
Oh.
Nice.
Remember that little boy that I was talking about that we were founded for? So we have created a scholarship program based on him. And so it is in his legacy, and we raise funds for an entire year. We have a family who's been very generous since the inception of the scholarship. The Port of Brownsville has been behind us, OmniTracks. Many local individuals come in and they donate specifically for that scholarship program. And we really have a scholarship selection committee. At the beginning of the year, we're going to look at our children.
Okay, already children that are kind of enrolled.
Already enrolled children. And, you know, we typically choose children who have no insurance or who have commercial insurance. Because our children who have Medicaid, we have federal grants and other programs that can help them based on poverty guidelines.
Got it.
And so for these kiddos, we're going to be looking at what is your medical journey going to look like, not just with us, but what does your future look like? Does your family come to us with any medical debt? Do you have really great attendance? Because the more a child attends therapy, the better outcome we're going to have. And then parent involvement. So we're looking at all these different things for a family.
Like truly deep case management and for each child.
Absolutely, because we want to be very good stewards of these donors' funds.
Of course.
And so we will select our patients based on that. Currently, we have 4 patients who are on the scholarship this year. And those children will cost Moody Clinic $50,000 for an entire year to run the scholarship program, because it pays for 100% of their therapy.
Wow.
Oh, wow.
Wow.
Incredible.
Gotcha.
And so can you walk us through, as if I were a parent that had a child with special needs, whatever that special needs may be, how would they arrive to the clinic? How do they land with you?
So our patients are referred to us by physicians.
Okay.
And so either it's a pediatrician, maybe an orthopedic surgeon, a neurologist. Somebody has truly generated a referral to us. And it'll specify what they're needing. Do they need physical therapy, occupational speech, and then the diagnosis that they're coming into us with.
That way we clarify that it's not like a walk-in,
No.
you know?
We really truly are a medical clinic at the end of the day. And so that is how they get to us. The hardest part for Moody Clinic is that we have a wait list. And so our children will sit on that wait list. And that's the thing that keeps myself and the team up at night is we have children waiting to get into therapy with us.
And what do you think are the factors that have contributed to this growing wait list?
I think that the wait list, first and foremost, it is the reputation of our therapists. Since coming on board, myself, Eric Morales, the COO, we really strongly believe in continuing education for our therapists and investing in all of our staff members. Is there going to be a training that makes you stand out as a physical therapist, an occupational therapist, a speech therapist, a front office clerk? What is going to make you stand out? And so in the rehab world, these certifications can cost thousands of dollars, and we go up for grants for them. And so these individuals that are working with us have some very specialized certifications. And so that becomes, parents start to seek them out for that reason.
Of course.
So
They want the best care
they
for
want absolutely. They want the best care for their children. And so that definitely drives our wait list up. The other thing that then drives our wait list up are these financial assistance programs. And I'll explain it in a couple of different ways.
Okay.
With our patients who have Medicaid. In a for-profit clinic, Medicaid, your therapist will write an evaluation and Medicaid will authorize a certain amount of visits per month. It may just be 2 visits per month, where if Moody Clinic therapist recommends that a child is in there 8 to 10 visits a month, we're going to see that patient what is recommended. No matter what Medicaid tells me we can do, we'll do what you think is best. We're going to do what's best for that patient. And so when you have that reputation as well, then families are like, I need that care because at another facility, I may only get 2 visits a month, where at Moody Clinic, I'm going to get the 8 to 10 that my child needs.
So because they might know that, it's just more a driving factor that they want that care.
Absolutely.
That makes total sense.
Of course. I mean, especially if you're trying to cover like everyone's unique background and their specialized care that they need too.
And I'm assuming not only the specialized care, but also the team itself, the staffing, correct?
Absolutely. That's the hardest thing that, down here in the Rio Grande Valley, especially in Cameron County, the statistics on, therapists that are up in Hidalgo County are much greater pool than we have down here in Cameron County. And then we've got to look at what is the ratio of pediatric therapists to adult patients or adult therapists. And so that's another driving factor for us and being able to fill those spots for our clinic.
Given the wait list and some of the patients that you have seen, can you tell us a little bit about maybe some success stories that you've had?
Of course, I always love to brag about the kiddos at the clinic. One of the ones that comes to mind is our Zoli Poli, our little Zolaya. I received a phone call from a physician several years ago now, and he said, I've got a patient, and she has spina bifida, and I need your help. She's traveling to Corpus for therapy at this point, and we really need to get into Moody Clinic. I said, of course. If a physician's calling, requesting this for their patient, we try to honor that for them. And he said, we're desperate. We've got to get her in. Not a problem. So she comes in, and lovely family. Mom and dad both worked, and they're actually our newest video that we have out at the clinic. It's on this family. And
we can go ahead and link it so people know. Also, just quick interjection for anyone that might not know, could you explain just very simple what spina bifida might be, like what a child struggles with if they were to be diagnosed with that?
So what I always tell people, when I'm giving tours, because a lot of people say, well, what is spina bifida? And when they see the video of her and her back,
they understand.
I always tell them it's almost like a knot in your hair, but it's in your spinal column. And so your spinal column is, it's all tangled up. And so they've got to detangle that. Okay. That's very simple, very layman's terms.
Right.
But they've got to detether or untangle that spinal cord.
Okay.
And they're going to have difficulty walking. They may have difficulty with sensation for going to the bathroom. Just kind of depends on the severity of the spina bifida. It's not really, not very a common occurrence anymore with good prenatal care. And this was just a natural case of spina bifida. But we've got Miss Zoli at the clinic, and she's coming in, seeing our physical therapist, and she's rocking it. She's in, braces, and then all of a sudden we get to take off the braces, and it's just been a journey to watch this little girl. But the thing that I think we're most proud of is that she was one of our scholarship recipients.
Oh.
This sweet family, dad was working 2 jobs, just trying to afford her surgeries because it's what I was talking about at the beginning, right? It's not just Moody Clinic's expense. It's going to be their surgeries, hospital stays, all of the equipment that comes with a child. And so,
and their everyday life.
Absolutely. So he was working 2 jobs. Mom was working a job. And I had the pleasure of calling him into the office, Eric and I did, and talked to him and let him know that they were going to be a scholarship recipient. And Dad looked at me and he said, "What do you mean, Jessica?" And I said, "Well, for an entire year, I've got you covered. You will not have to pay one bill for Moody Clinic." I said, "Don't worry about a thing." And he just looked at me and he said, "I think I could maybe quit my night job and be a dad," right? He said, "I get to spend some time with my girls, and that means a lot to me."
Wow.
And so that was it was really wonderful to be able to give them that scholarship.
Course.
But she's doing amazing. She no longer is wearing her AFOs. She can walk. She can run. She is not using a walker anymore. And so she's been an incredible success story for us.
Wow. I know.
I think that's one thing that I feel like people don't see is the personal struggle that parents have when like you guys help out with the procedures and everything like that, because parents have to take time out of their day, get second jobs and figure out how to cover these things. So it's very nice to hear that there's services out there that can help with that.
Yeah.
And I feel like that just speaks as to why parents might be so demanding as to wanting to be a part of Moody Clinic, because not only does their child get, incredible care, but they feel sort of taken care of in a way too.
There's a bit of a weight that's lifted off of them.
Yes, of course.
One of the things that we're most proud of is that we are, by the end of the year, we're going to have a family support group, because we started seeing this, have parents come in all the time and just different backgrounds, different stories. And we just kind of started thinking about it and thought, you know what, we're not treating the whole family at this point.
Right.
We're treating the child. Yes, we're providing some amazing financial support for the family, but there's a missing component and we need to fill that gap in. And so we're going to be hosting a family support group for our Moody Clinic patients, which is really exciting for us, really kind of working on the whole family.
Right.
Our 2 moderators, they were great. They even said, should we have a sibling group? Because it's, siblings too that come to therapy.
Of course, because one thing that we can speak on here from the department, we have a healthy brain and aging program. And part of that program, obviously, it's not only just for the elders, but it's for the caregivers as well, because it does take a toll, whether that be dementia, spina bifida, autism, whatever the case may be, just taking care of someone else aside from yourself in that way where it's kind of like not the extra mile, but it's a little different than just taking care of a child with no needs. It does take a toll on the person in whatever age group. And what we found is that we tend to think that the age group that is mostly a caregiver might be maybe 50, 60-year-olds taking care of their parents, 80, 90-year-olds, and that is not the case. It's mostly within the 18 to 24-year-olds.
So sometimes it's a very close family members.
Exactly. So we have to take care of them as well, for them to feel that support and like the ongoing thing of, I matter too, and I'm going through it too. And so with these scholarships and support group, are there any future goals that Moody Clinic has set for themselves?
So Moody Clinic was actually approached by the Knapp Community Care Foundation based out in Weslaco, Texas. They're very interested in Moody Clinic opening a satellite location in the Mid-Valley.
Oh, since it's only based out of Brownsville, correct?
Yes.
Wow, so that you can reach so many people like from Rio Grande City or,
Yeah, because many times families have to travel
yes,
hours
and
to reach therapy.
it is a long drive, especially like with the traffic nowadays. Just to get like from here, we are in San Benito, just to get to Weslaco, sometimes, you might think it's a 15-minute drive and it isn't. So, I mean, if you're traveling with family and kids, that's really nice. And when does this project might start or by when do you think that this Clinic Mid-Valley can come to light?
So we don't have a set
Specific
date for
dates?
that
Okay.
yet.
Am I getting ahead? Am I getting too excited?
No, I mean, it's so natural to get excited because it's such an exciting opportunity. But we're currently doing some research and kind of trying to learn what the need is in the Mid-Valley.
Yes.
So we've been trying to meet with different community members.
Nice.
We're planning on meeting with pediatricians later this month, actually.
Wow. So
to
it's really in the
determine-
works. Really in the works.
Yeah, we just need to determine that there's a need, and once we know that need, we'll know what we have to do next.
Nice. And also, I meant to ask this earlier. You know, how can the health department help Moody Clinic?
I would say get the word out about Moody Clinic. The biggest need that we have is obviously donations. You know, in order to be able to run these programs,
Of course,
we
it
need
needs to be funded.
donations. Yeah. And so just community support and getting the word out to our community is most helpful.
Okay, then you can count on that because it is incredible work. It's very much needed, and I'm sure many families would be grateful to just have that sigh of relief of getting excellent care, but also being taken care of themselves.
Yeah.
Is there anything else that you might like to add? You know, something for our listeners?
I think that if somebody wants some more information on Moody Clinic, you know, if they want to learn more about our services, if they want to learn ways in order to donate and give back, you know, they can go visit our website at www.moodyclinic.org. And all the information they're going to seek is there. They can also seek us out on Facebook, Instagram, LinkedIn. We're all over the place.
Nice.
Check us out and check out what we're doing.
Well, you heard it here first. Thank you so much. Thank you for your time and thank you for this wonderful information. We will link all your socials and your website below so people, you know, have access to that, and if they want to learn more, they can go ahead and visit that. But thank you so much for your time, ladies.
Thank you so much.
Yeah, thank you for hosting us.
And of course, thank you so much to all of our listeners for joining us on another fantastic episode of Health Yes. Make sure to follow us on all of our social media platforms. Click those like buttons, notification bell, so you don't miss another episode of Health Yes. Thank you so much for joining us, and we'll see you on the next one. Don't forget, stay safe, stay healthy, and stay educated. We'll see you on the next one.
Bye.
Bye.